Hey there, Dr. Richel here. I'm a pediatrician in suburban New York. The YouTube channel is Dr. Pete's Office, and today I'd like to tell you about 5 normal newborn behaviors. Things that we see in newborns that I don't want you to worry about because they're normal and there's no treatment for them. The first of them is sneezing. Newborn infants sneeze because they're clearing secretions. It's quite normal, no treatment necessary, and that can last 1 to 2 months. So not to worry about that. The second is hiccups. Usually babies will hiccup when they're in utero, and then they hiccup when they're outside of the womb as well. This also can last 1 to 2 months, and the takeaway pearl here is to continue feeding through the hiccups. You need not stop a feeding if they occur during a feeding. And there are some myths that I love to break. One is to stop the feeding and give sugar water. No, that's not necessary. The other is that folks might say, stop the feeding and throw salt over your shoulder 3 times. Nope, that's not necessary either. So hiccups are totally normal, and you feed right through them. The third is the Moro Reflex that I'd like to tell you about. The Moro is a normal neurologic reflex named after Dr. Moro, and it's that they just will instantly throw their hands up, quiver their lips, and then settle. This can happen in response to a loud noise, but it doesn't have to happen in response to a loud noise. It does not mean that they don't hear properly. It can happen when the crib is bumped, or it can happen just out of the blue, just spontaneous, just like that. So normal neurologic reflex, not to worry, and no treatment necessary. The next is periodic breathing of the newborn. This also can last 1 to 2 months like the others. And that is where a baby will stop their normal breathing pattern, which is twice hours, but don't bother counting. And they'll be pink, swaddled, well-fed, no problem, no color change, but all of a sudden, after they've stopped that, and you won't know that, even up to 15 or 18 seconds, then they'll start again and gather several breaths and sigh. It's kind of like this. I liken this to them kind of awakening, seeing the state of the world right now, and going back to sleep. That's, again, so not to worry about that. And the last normal newborn behavior that I want to tell you about is eye deviation. Eye crossing or eye rolling, any which way but loose, and they can basically stare at their nose if they wish for up to 6 months on and off. After that time, then they travel and track and follow us normally, unless there's an inherent muscle weakness, which is fixable surgically, and that's rare, so don't worry for that. Otherwise, eye deviation, eye crossing, it lasts up to 6 months. They can just stare at their nose if he or she wishes to. So, sneezing, hiccups, the Moro reflex, the startle, periodic breathing of the newborn, and eye deviation. 5 normal newborn behaviors. They require no treatment, so don't worry about them whatsoever, and be ye reassured. We'll talk to you soon, and congratulations. Till next time, bye-bye.